Hello everyone and welcome to this special podcast episode for the Social Work Week, and our theme for this year is Beyond the Bedside, the role of social workers in palliative care. I am Bhargavi, accompanied by Shreya, and we are the postgraduate students in Social Work Department. Today we are honored to have Dr. Anuja Damani, MBBS MD Palliative Care KMC Manipal. Welcome to this program, ma'am, and we are glad to hear your insights on this program.
Thank you, Bhargavi, for having me here, and I'm really glad that I have this opportunity to talk to you guys. And it's important that we talk about multidisciplinary teamwork in palliative care, and the role of social worker is, something that we need to spread the message across our country. So, yeah, I'm happy to have your questions.
To begin with, can you share about your journey to palliative care and what inspired you to take up this field?
That's really interesting story. Actually, I did not know about palliative care before I entered into the branch. I took up the branch, just by chance. But what's more important is what actually led me to stay back and continue with the branch. So, I started off my journey in 2012 when I took MD in palliative medicine. And, when I entered the branch, I did see that, there's a lot that medicine can offer for a person beyond only cure or, control of pain and symptoms. There's much beyond this. It's about the holistic treatment, which is the approach of medicine, ideally which should be the approach of medicine. And this is not new. I would say it goes back to ages that medicine is supposed to heal and relieve suffering, and that is what palliative care is about. And what made me stay back is so much of pain and suffering that I saw when I actually started working in this branch. And of course there were great mentors that I have had, and I was blessed to have a good team, including some of the social workers and my psychologists and patients themselves and carers. So it's been a journey which is rich and fulfilling. And I'm very happy to share my experiences with you.
Yeah, ma'am. So you have mentioned that you have worked with social workers as well. So what do you think are the roles of social workers in the palliative care setting?
Well, social workers do have a very important role as a part of team member in palliative medicine. I would say this is something that we as doctors or healthcare providers who are working with the diseases forget to actually offer. When we treat a patient, it's not only the illness that we are treating, it's a person, a living, breathing person that we are treating. And I think it's important that we address the suffering of the person, and social worker has a very important role to play in that sense, because this human being is a part of society, is a part of family, is a part of community, and social workers do address the other side of it. What you actually told in the theme of this podcast is beyond the bedside. It is beyond the hospital structures. It's beyond the only addressing about the cure or illness. It's beyond only medicine. It's about extending our outlook towards a holistic assessment and a holistic care towards a person. And also it's important that we look at it in terms of addressing suffering, because suffering is not only physical, it may be psychological, it may be social, it may be spiritual. So addressing emotions, listening to patients, voicing out their concerns. They are in vulnerable situation, they may not be able to voice out their concerns to especially doctors who are looking at the disease. it's very focused on disease. And the outlook of social worker goes beyond that. They listen, they are the voice of patients, they are the voice of families who are suffering. So I think social worker does have a big role to play. Okay.
And ma'am, as you told that the social worker role is so crucial, have you ever noticed, like, is there any challenges that you have foreseen?
Well, there are a lot of challenges. One, the biggest challenge is about recognition of the role.
So, as students of social work itself, both of us are working on our research on the palliative care topic itself. So, I'm basically working on developing a palliative social work curriculum.
And mine is developing job description of social worker in palliative.
Right.
So, we are trying to fill in that gap. Like, we do not have any such curriculums on palliative care where a student of social worker can later work in the future in particular field. So my question for you would be, like, what are the advices to the students who are willing to work in the palliative care setting? So what suggestions you would give, ma'am?
Well, see, it's important to understand what palliative care is. It is not about only physical suffering. It is an approach which addresses physical, psychological, social and spiritual suffering. In short, it is a holistic care of patient, and it is not only about cure or palliation, it's about the quality of life that a person is living. So I would suggest for students who are taking up palliative care social work, it's important to understand, to develop that attitude of listening to their patients and families, empathizing with them, and to develop that approach where we are addressing suffering and improving quality of life. So forgetting the focus on the outcome but focusing more on the journey is more important in palliative care. So that is what I would suggest for young upcoming students who are wanting to take this noble work, that they should look at or focus at the quality of life of patients.
Holistic approach, yes.
Thank you, ma'am. This brings us to the end of this meaningful conversation. On behalf of Department of Social and Health Innovation, Master of Social Work Program, Prasanna School of Public Health, Mahe Manipal, we sincerely thank you, ma'am, for sharing your experience and even your perspective on palliative care. To all our listeners, thank you so much for tuning in. By this conversation, I hope this has inspired you to look at the healthcare beyond the bedside.
Until next time, take care and keep spreading awareness.